Good morning to all. I am Jabaseeli Gladies, Professor, HOD, Department of Mental Health Nursing in ES College of Nursing, Villupuram. Today in this e-learning, we are going to learn about psychological first aid. So it is an immediate, supportive and compassionate response provided to individuals who are experiencing emotional distress due to crisis, disaster or any uneventful loss in the family. The aim is to help the affected person feel safe, comfort and hopeful. At this moment, they don't need therapy, but they need a practical support and assistance to come out from the situation. So it focuses on reducing immediate distress and promoting adaptive coping. So it does not force people to explain the trauma that happened to their life. What is psychological first aid? It is a human and practical support which is given at an initial period to a people who are experiencing a distress or a stress after a natural disaster, accidents, medical emergency, violence, abuse, conflict or any sudden loss or trauma. So psychological first aid is to listen them and to protect them and to connect with the other community health services. What PFA is not. It is not a counselling or it is not a psychological debriefing or explaining the trauma what has happened to them or making them to share the trauma experiences to us. It is not forcing people to talk to us, or it is not a diagnosis of any disorder or not a deep questioning technique. So it is just a support without a pressure. So it is a similar to in purpose to physical first aid. In physical first aid, we treat wounds to the body, but whereas in psychological first aid we support mind and emotions. The main objectives of psychological first aids are to promote some support, provide comfort and calm, enhance coping and resilience, connect with support systems and reduce long-term psychological impact. So who can provide a psychological first aid? Psychological first aid can be given by nurses, any healthcare professionals, trained volunteers or any first responders, teachers, social workers, community leaders or individuals who received training in giving psychological first aid. Now we'll see the principles of psychological first aid. The model used for psychological first aid is the look, listen, link model. There are three components in look, listen and link. First, the component look. You observe for the safety and need of the patient. Here, identify the individuals who are having injury or who are in immediate danger, who are alone, who are crying, who are panicking and who are extremely distressed and who are in vulnerable group and who are having confusions, disorientations towards the stress. So you identify them and you make them feel and comfort. The vulnerable groups are children, elderly, pregnant women and those who are affected previously with mental disorders. The next component is listen. Provide comfort and support. So the listening technique you have to follow here, that is a non-judgmental and respectful attitude towards the patient communication. So how can I help you right now? So the feelings, the fear what you are facing are natural. Listen, these are the things you have to speak or we have to use when we are talking to a client. So listen to the client without interrupting or forcing nature. So acknowledge the feelings of the client. Next component, the next stage we go into the link. So we have to connect to the services and various support systems to the client. So first assess with the basic needs, the water, food and shelter. Then make the client to get attached or connected to his family and friends. Or if he is severely injured, the emergency medical services can be arranged and psychological services also can be connected. Encourage positive coping mechanisms. Discourage negative coping or abnormal coping like self-harming or alcohol usage or drug usage. So encourage positive coping skills skills, provide accurate and relevant information, and necessary it can be followed up. So what you should not do in a psychological first aid. So do not force people or do not force the person to talk about the trauma, and don't give false promises or don't give any false reassurances saying that everything will be okay or everything will be fine. Do not judge the reaction or belief of a person. That is very important. And be a culturally sensitive, understands the beliefs and practices of every individual. Do not spread rumors or miss false informations, and do not pressure someone to take a quick decision. Give time and give the time for individual to decide and to choose the options. So what are the main actions behind the psychological first aid is, these are the component. The first component is ensure safety and comfort. This is the primary priority of any individual, to understand the need of a client in his distressing situation. You will have to make the client to be safe and comfort. So immediately move the client from the danger area to the very safe place and provide immediate physical needs, whatever he wants. When you want to drink water, or you want to take food, or you want to come under a sheltered place, you make it comfortable and offer a quiet and a calm space, and reduce the exposure of the client to a very distressing situation, again like that's the same sights or any loud noises. And you tell the patient or tell the client that they are safe now. So that feeling safe is the first step towards emotional recovery. So the client should feel safe and he should feel comfort. That is the first action of psychological first aid. Then you stabilize the client by reducing the stress. So speak in a very soft and steady tone. Encourage patient to breathe very slowly and in a relaxing manner. Provide reassurance with supporting words saying that you are not alone, we are here, so we will take care of you. So you talk with some supporting words, and you tell them, and you understand their feelings, you normalize their feelings. You have to say that, see, everybody in this situation will be scared, so you don't worry, this is a normal reaction. Like that we have to explain them. So by explaining all this and approaching in a soft and steady tone will stabilize the emotions of the individual. Third is information gathering, understanding the needs of the individual. So not everyone requires the same support. Some people have need some other needs to be met, and some people will require some other needs to be met. So ask simple and practical questions. Make a patient to choose on his own. Don't force to make any decisions immediately. So you can ask some simple practical questions like, do you have any injury? Is there anyone you want to talk to them? What is disturbing you right now? So such questions you can ask them practically and very simple way, so that they will feel comfortable and they can give you information. So the needs should be understood. So when the needs are understood and met, immediately the client will be in a comfortable zone. So assess the immediate needs, assess the emotional and practical worries or concerns, and if any existing supports, if you want to talk to his family or friends, he can get assistance. Next is practical assistance. So help with the basic things. Suppose he wants to go to the family members, you can locate his family and you can arrange the transportations, and if any medical care he needs, he can take his medical care, or any small immediate problems are there, it should be solved immediately. Give explanation clearly for his doubts, and if you do small things, will definitely make a big difference in the individual's mind. Next step, you move on to the support system connection. Okay, very important. Connection is important to get support in the panic situations or in a distressing situation. So encourage to talk to his family members or any friends nearby or whoever it is. You can contact and talk to them. And if any emergency medical services are needed, you can make a link to the emergency medical services. Or if you need any psychological help, he can be connected to the psychologist, or any further psychological follow-up, he can be connected. And make sure that the client should not be left alone. The next step, empowerment. Empowerment will be achieved by encouraging positive adaptive coping. Already I told we should not encourage negative coping or harmful coping like self-harming, drug users and alcohol users. So encourage positive coping techniques, and you give choices and let him choose, and don't force him to choose choices. And you can ask simple choices. You want to sit here, you want to sit outside, like the small simple choices you can give. Ask them to choose their own choices. You identify their strength, you identify their weakness, you identify their positive coping skills which already possess in them, that you can make him to promote again, get again promoted. So the last step is very important. You cannot leave like that. A follow up and referral is needed. So refer to a mental health services if he is having distress that is worsening, or the distress is persisting for continuously without any decrease, or is showing any self-harm behavior, or is showing some psychotic symptoms. If all these persist, definitely he need to be referred to a mental health professionals. So be present to the situation, show respect and offer hope are the three main core actions of psychological first aid. As we go into further into psychological first aid, the communication skills are very important, as it is an effective tool in bringing the client out of the distressing situation. Some things you should not do and some things you should avoid. So what you should do, you should speak very gently, very slowly, and you should be very calm, and you should be very patient, and you should be very polite in nature, and you have to use very simple and clear languages, and you should show empathy and respect. You should validate their emotions, you should normalize their emotions, you should acknowledge their emotions, and you should allow the person to express his feelings. You should maintain confidentiality, and you should be very important. You should be culturally sensitive, giving importance to every culture, beliefs and practices. And it is okay to be feel scared. Anyone would feel this way. These are the normalizing emotional speech you should speak to the client. And what is the things you should avoid? You should avoid criticizing, blaming and giving unwanted advices, false reassurances, false promises, and showing your emotions, showing your anger, showing your stress to the client, and talking more than listening. You have to make the client to talk more, and we have to listen more. And you should not minimize the feelings of the client. So very important, some things should be avoided when you are showing an empathetic listening to the client. So empathy is a key tool in psychological first aid. So who are the target groups or the vulnerable groups for psychological first aid? The trauma survivors and the first responders keep on witnessing the crisis response reactions, and the witnesses who are frequently exposed to this type of distressing situations and the response, and providing psychological first aid to all the victims, survivors, families of victims, and vulnerable groups. The common vulnerable groups are children, elderly, pregnant women, people with disabilities and pre-existing mental illness are more vulnerable to this type of distressing situations. So interventions or the first aid techniques, methods, steps, what we use should be age and culture appropriate. So as we move further, these are the common reactions to crisis. Common reactions as category wise, the responses are divided: emotional response, cognitive responses, physical responses and behavioral responses. So emotional, the client will show the fear, shock, anxiety, anger, guilt, all these type of emotions that a client will exhibit because of crisis. Cognitive aspects, the client will be in confused state, he cannot have a concentration adequately to some things, disorientation will be the, and the physical reactions or the responses to crisis will be disturbances in sleeping, and he will have feel palpitations and all eating disorders as progresses, as response progresses. Behavioral response to crisis include withdrawal symptoms. He will be sitting alone, not talking to anybody, showing no interest in talking, in eating, or that he will always prepare to sit alone. Isolation very common, and he will be always crying, agitated. So these reactions are normal responses to an abnormal situation. So as we go, it is our important as a nurses, we should know what is our role in psychological first aid. So our role as core action principles, we know we should provide safety, we should provide emotional support, we should assess the needs and prioritize, observe the priorities, and we should provide non-intrusive support. We have to first meet the emergency needs, immediate needs like food, shelter, and medical care. We should not allow them to get self-harmed, or they should not get panic behaviors, involved in panic behaviors. And we have to keep our professional boundaries, and we have to promote the social support, we have to connect them with the social support, and we have to document, report the needs. That is very important, documentation and reporting. Further, if they need, they should have a follow-up and referral. And very important is, we as a nurses, we should maintain privacy, confidentiality, and dignity always. So it is not only the responsibility of a nurse to take care of the victim, or to take care of a person who is facing the distressing situation after the crisis. It is also the nurses to take care of themselves to handle such cases. So we have to take a regular breaks. When we are exposed to prolonged crisis response, we should have a regular breaks. And debriefing with the colleagues, that is sharing our experience with our team members, will let our distress or let our emotional stress down. And practicing grounding or mindfulness or some relaxation techniques will definitely help us to handle such situations in the future. And if we are having any signs of burnout syndrome or vicarious trauma, we have to go for a support. We have to seek a professional support. So better, a supported nurse only will provide a better support for the individuals, persons who are affecting from after the disaster or any accidents or trauma. So with this, I hope you have understood what is psychological first aids, what are the core action principles, steps you have to follow, and thank you.